Okay, so here is exactly how non-surgical spinal decompression works. It's a motorized table that you lay on that gently and precisely applies a distraction force, pulling the spine apart. Now, how this works is, let's say, here's your bones, right? Here's your vertebrae, here's your disc. If you're sitting with a bulged or herniated disc, this table will gently stretch and relax, and stretch and relax. And it does this on a cycle. Two things are happening when we're stretching and relaxing. Number one is it creates a negative pressure inside the disc. The negative pressure acts like a vacuum. So as we're stretching and relaxing, that negative pressure is what pulls that material back into where we need it. It pulls that jelly back inside to where it's supposed to keep it contained. The other thing that's happening is it gently stretches and relaxes. That pumping mechanism will pump nutrients into the disc, and that's what gives it more space. So number one is we're getting the material back into where we need it to be. Number two is we're thickening up the disc. We're giving it the nutrients that it needs to get bigger. And what that does is it gives more space for the nerves. And when you get pressure off the nerves, you get less pain and you get more function. That is why this is so specific. That stretch and relax mechanism. It makes it very precise. It makes it very effective. Very, very effective. Oftentimes, patients will say, well, isn't this the same thing as traction, a traction table? The answer is no. Spinal decompression is much more effective than traction. And the reason is because of that stretch and relax mechanism. That's what makes it so specific. Traction is just a stretch with your muscles pulling and your muscles contracting. Spinal decompression is stretching without your muscles contracting. So we're just focusing on that disc, nothing else. We're treating the disc. The disc is the problem. That's what needs to be fixed.